Hi, this is a nice case of a patient who presented with epilepsy and was investigated first with CT of the brain that was negative, and then we performed the MRI of the brain with the question if there are any signs of epilepsy focus. What we noticed was changes located juxtacortically in the area of gyrus singuli that show higher signal on a flare sequence, appear to have a microbubbly appearance with very tiny bubbles juxtacortically. There is no perifocal edema. There was no contrast enhancement. Here you can appreciate the multinodular and vacuolating appearance on this inversion recovery sequence that is very sensitive for anatomical structures. Also well seen on the axial T2 weighted sequence with many small bubbles. There have not been associated vascular structures in this area, so no vascular malformation, and this all looks to us as MVNT, that is multinodular and vacuolating neuronal tumor, the type of a low-grade tumor that is highly associated with epilepsy, but otherwise an incidental leave-me-alone finding. If you enjoyed the case, consider reviewing my other cases and subscribing. I will see you in the next video.